Hello, everybody. Dying.
Talking to people in public. Phobias are the most common minor mental illness, affecting as many as 10 million people. Women are more likely to be affected than men. They can be treated with hypnosis or desensitization, a process where the patient is gradually forced to face their fears.
I guess I'm pretty scared of dying.
Thanatophobia is the fear of death. Thanatophobia is defined as an intense, overwhelming fear of death. It is assumed that this fear relates to one's own death. Every case of thanatophobia is not the same, because everyone is different.
So I don't know, I think it's just one of those things that everybody's kind of scared of. Being murdered. It's not a great thing, is it?
Causes of thanatophobia. As with any phobia, the individual coping with thanatophobia has experienced a trauma associated with death. Perhaps the thanatophobic individual has experienced the loss of a loved one. Perhaps thanatophobia involves a fear of the unknown. Fears about what happens at the point of death.
I think it's horror films. They just kind of make it more scary.
Symptoms of thanatophobia involve obsessive thoughts, difficulty thinking about anything else, fear of losing control or going crazy, fear of fainting, anxiety, dizziness, shaking, palpitations, shortness of breath, chest pain, discomfort, trembling or shaking, feeling unsteady. There are a number of different ways to treat thanatophobia. These can include talking to the primary physician, who will refer the person to a therapist who specializes in the treatment of phobias, traditional talk therapy that will assist the individual to recognize and cope with their phobia, self-help techniques, support groups with other individuals coping with this phobia. In the most extreme cases of thanatophobia, anti-anxiety medication can be prescribed.
I'm scared of flying.
Pteromarinophobia is the fear of flying. It is a fear of being on an airplane or other flying vehicle, such as a helicopter.
I first came across it in 2008 when I went to Spain.
Causes of pteromarinophobia. If you have ever experienced a traumatic flight, pteromarinophobia may occur. Even watching extensive news coverage of airline disasters can be enough to trigger a fear of flying. Symptoms of pteromarinophobia are shaking, sweating, gastrointestinal distress, and heart palpitations. Become flushed, disoriented, unable to think clearly, feel upset and irritable, lash out at friends, relatives, or airline personnel.
I feel normal. It's just a thing that I've got used to.
How to overcome the fear of flying. Fortunately, the fear of flying is relatively easy to treat, even without knowing the underlying cause. If you do not suffer from other physical or psychological disorders, you may be a good candidate for a fear of flying course. These classes typically last 2 or 3 days, often over a weekend.
I'm scared of talking to people in public.
Glossophobia is the fear of speaking in public. Glossophobia or speech anxiety is the fear of public speaking or of speaking in general. Glossophobia can be caused by a number of experiences in life, including a traumatic event in early life, which may or may not be directly linked to speaking in public, having to perform the under-socialization of the child, whereby the child doesn't build up confidence in his or her own ability. This can often be caused by an overprotective parent, for example, a low self-esteem, where the person feels feels that what they have to say isn't important, the expectation of failure, sometimes due to being overly criticized in early life.
I'm fine with it most of the time. It depends what I'm doing or what I'm talking about.
Symptoms of glossophobia include intense anxiety prior to, or simply at the thought of having to verbally communicate with any group, avoidance of events which focus the group's attention on individuals in attendance, sweating, increased heart rate, feelings of nervousness or panic attack, dry mouth, tense, weaker quivering voice, stiff neck or upper back muscles. In severe cases, some people may even experience nausea or vomiting from the stress and anxiety. Treatment to help with this fear include taking public speaking classes such as Toastmasters. International or Association of Speakers Club will be able to alleviate your fears of speaking in front of others and improve public speaking skills. Counseling or psychotherapy may also help you to address the root of the problem and learn effective techniques to deal with this condition. Natural treatments such as herbal and homeopathic remedies have proven to be effective in relieving fear, anxiety and nervousness associated with public speaking events. Homeopathic remedies are not only safe and gentle to use but also fast-acting.
I'm scared of spiders.
Arachnophobia, fear of spiders. Arachnophobia is commonly known as the specific phobia of spiders. Although the term also covers the fear of scorpions, ticks, mites and daddy long-legs. The majority of sufferers, however, are mostly phobic of spiders. Arachnids aren't very popular amongst many people, but for some they are much more than just a household annoyance. Sufferers of arachnophobia can go to many lengths to avoid coming into contact with spiders, such as avoiding camping or going abroad, ritually checking the bedding and clothing for spiders, even avoiding films that may contain spiders. Causes of arachnophobia are like many types of phobia. Arachnophobia can be triggered by a traumatic incident involving a spider that occurred in the past. In some cases, this can be an event that a sufferer cannot even remember.
My uncle used to collect a bunch of spiders, like especially tarantulas, and he used to follow me around the house, chasing me, and I really didn't like it, and yeah, it was just really horrible. It was kind of traumatizing.
Symptoms of arachnophobia include excessive sweating, clamminess, rapid breathing, nausea, dizziness, rapid heartbeat. How to treat arachnophobia? Systematic desensitization is the most common way that arachnophobia is treated. It is a therapeutic intervention that reduces the link between anxiety and the objects or situations that produce the anxiety. The goal is to reduce or eliminate the phobia and to help the patient cope with the fear. They will undergo relaxation techniques that will help alleviate the tension that is in the patient's daily life.
Yeah.
Yeah.
I would not call that phobia.